And we are back. Joining me now is Republican Senator Rand Paul of Kentucky. Senator Paul, welcome back, sir. Good to see you.
Thanks for having me.
Let me start with what you said about the House bill, because to me, the criticism seems similar. You were not happy. You said the Senate has a chance to fix Obamacare after the House did not. And you, as part of your op-ed, you said there were many areas of reform considered: repealing regulations, cutting taxes, and introducing free market reforms into the system. The bill so far falls short on two of these three. Essentially, you said it just cuts taxes. How would you assess the Senate bill on those three key requirements?
I think the bills are actually very similar. Both of them do a good job of cutting the Obamacare taxes, and I'm all for that. But if you keep the Obamacare spending, or you stretch it out over a many-year period, you're going to have spending without the revenue to pay for it, and so that makes the debt worse. The other thing is that in the current Republican bill as it stands, they repeal 2 out of 12 regulations. Well, the regulations, you know, the mandates that go into your insurance, you have to have pregnancy coverage and dental and vision and all that. That's what added the expenditure to insurance and caused the death spiral that's going on in the individual market. So if you leave those regulations in place, 10 out of 12, if you tell people you can wait till you're sick to buy insurance, that's what will happen. People will wait till they're sick to buy insurance, and you get this death spiral with the rising prices. So I don't think we fix that, except for Republicans say, oh, we're going to fix it. We'll fix it by dumping a bunch of taxpayer money into the coffers of insurance companies. Right. So it's like $110 billion new federal program to give money to insurance companies that make $15 billion a year. I think it's a crazy idea. So we've got to get a long way towards repeal and market reform to get me on board. But I think we're willing to negotiate is really what is the message we're sending today.
Okay. It's an interesting way you just ended there. I have to say, what you just said about the subsidies and the tax credits, however you want to describe it, but you're absolutely right. It's government money, and it looks like it's in order to pay for insurance, and it goes into the insurance companies. It's an interesting description, and I don't think many people would disagree. How are you able, it seems as if, how are you able to negotiate that much differently from what this bill looks like that it would get you on board? It doesn't sound like they can really get rid of those subsidies, or they're going to lose too many other senators.
Well, that's the jockeying that will happen now. And I think by 4 conservatives announcing early on that we can't support the bill as written, we're going to try to tug it in our direction, and we'll see. Will it be adequate for all of us to vote for it? Sort of unknown.
What are you willing to eat?
Will they come at all in our direction? Like that, we don't know that either.
Look, I know you don't want to show your cards in this case, but I guess, look, to get to yes, it sounds like there's something you're going to have to like go, well, I don't like this part of it, I don't like that part of it, but I'm willing to take one for the team. What's your line on that? I mean, I'm sure Mitch McConnell really wants to know. And look, you and your dad were always nicknamed Dr. No, and so maybe there isn't a way for you to get there. But what is that line for you?
There are broad areas that have to be a lot better than they are. Repealing regulations, because that adds cost to insurance, and we're promising people we're going to give them less expensive insurance. That promise is a false promise if we don't get rid of the regulations. So we're only repealing 2 out of 12. We could go in the right direction and repeal more. That might be helpful. The other thing is that...
So all 12 isn't a demand. All 12 do not have to be met to get your vote, but more than 2 is what you're saying.
Well, what I would say is the current bill has 2, and I'm for 12, so there could be a compromise somewhere in between that. But, you know, we start with our positions, but our position had no leverage if it's me by myself or Ted Cruz or Mike Lee, Ron Johnson. By ourselves, we have no leverage. Together, the 4 of us have some leverage. We're going to have to decide, are people willing to tug the bill in a direction more towards the marketplace, less regulations, but also less subsidies in the sense that we cannot subsidize something through borrowed money. This year, Congress will borrow $500 billion to meet our traditional expenditures, Medicare, Social Security, Medicaid, that we had before Obamacare. We didn't have enough money even for the things Senator, we had before we expanded.
What bill isn't going to have some subsidies here? What bill isn't going to create a deficit problem here? Do you really think the bill, as you've seen, even if they amend a couple things here, honestly, do you really think that's ever going to get that close to make you feel comfortable on the fiscal side of things?
We'll see. The thing is, the subsidies right now in this bill, we think may exceed Obamacare. So, you know, we can't with a straight face vote for something you're calling a repeal bill. I think when we look at the individualized CBO scores on Monday, I think that the Obama subsidies and the Republican subsidies are going to be virtually identical, and there's a chance the Republican subsidies are actually more generous than Obamacare subsidies, which I think would be alarming to those of us who are for repeal. I think also when you look at it, the actual spending year by year, we are estimating that in the first couple of years, this bill may spend more than Obamacare because they're promising the savings in the outlying years.
Right.
And this is a traditional trickery of Washington. Promise people something in year 9 and 10, and when year 9 and 10 comes, you change the bill.
I'll gladly pay you a quarter for that hamburger, sir, tomorrow.
Exactly.
No, but let me finish with this, though, because a lot of I know I probably haven't looked yet, but I'll get a bunch of tweets going, hey, I like KY Connect. Ask the senator why he wants to get rid of KY Connect. This would gut KY Connect. It has been running better than most exchanges.
In our state, most people got Medicaid. About 450,000 people got Medicaid that did not have insurance. So people say, well, yes, they now have access to health care. And if we were honest about it, that might not be so bad. Honesty would be that we paid for it. Under Obamacare, we just said the federal government would pay for it, but the federal government has nothing more than a printing press. We run a deficit every year. We have a $20 trillion debt.
No, it raised a bunch of taxes to pay for this.
No, it goes through the federal government. The federal government really runs at a deficit. We don't have enough
I know that
for
overall,
traditional.
but if you look at the bill within its own silo, it was designed, those taxes were designed to pay for this.
Right, and there's some chicanery in how we come up with the mathematics. What I would say is that Medicaid, in order to be paid for, if you really want to expand it, let the states pay for it. Why do we do the trick of saying the federal government should pay for it? Because one, we just borrow it. If Kentucky had to pay for it, that's the question. Would they like Medicaid expansion if we had to double the state income tax and double the sales tax? I think you'd get some pushback. That's the balance we need. People need to see the payment, and they need to see the benefit and make a clear-cut judgment. Do you want to pay more taxes for something? Most things in Washington, though, are sleight of hand, and it's done through borrowing. And we are running an annual deficit of $500 billion. You can match it up any way you want, but we are spending more than comes in for all of our programs.
Senator Rand Paul, I appreciate you coming on and bringing your perspective. Always appreciate it. Thanks.
Thanks.
All right, viewers.